The statistics tell a powerful story of a world in crisis. Half the world's population lacks access to the most basic health care. 6,700 newborns die each day due to a lack of adequate care. In 2020, 2.4 million children died within their first month of life. Despite dwindling global access to basic medical care and increasingly prohibitive healthcare costs here at home, the US healthcare providers continue to see, and in many cases discard, a surplus of medical equipment. A recent Johns Hopkins study revealed that collectively, US hospitals discard $15 million of unused surgical supplies every day. It's a mind-boggling figure, and it represents only a fraction of the unused medical supplies that enter our landfills each and every day. Seeing these challenges as opportunities for action, Partners for World Health was created to address them directly. After recognizing the immense level of healthcare needs around the world and the sheer volume of needlessly discarded medical material surplus throughout the US, Partners for World Health was determined to work with the healthcare systems to reclaim those supplies, assess their suitability for use, and to grant them a second life where they were needed most.
I took a job in the Middle East. I had the opportunity to travel to northern Pakistan and visit hospitals. That's where I had an unbelievable experience of seeing the way healthcare was provided in the developing world. There were 30 patients in a room, no heat, no bedclothes on the bed, and not enough wound care supplies to change the dressing. That was like a bell that went off in my head that said, we have so much in our healthcare industry that we throw away every day. And someday when I go home, I'm going to do something about it. Partners for World Health started actually in my house. And over the course of a year and a half, I had collected over 11,000 pounds of medical supplies and equipment. And eventually in September of 2009, we moved all of the supplies out of my house into the first warehouse. In 2021, we saved 500,000 pounds from the landfill, and over 440,000 pounds of medical equipment and supplies were shipped throughout the world. PWH shipped 1 to 2 containers holding 22 to 25,000 pounds every month out of the state of Maine to places in Africa, the Middle East, and Southeast Asia.
In order to grow Partners from its humble beginnings in a basement full of surplus supplies to today's level of success, we needed a team of passionate visionaries and supporters, which we've been fortunate to find. We also needed resources and donors who share our vision. Today, we have created relationships with those donors and are in close contact with them, like when we pick up supplies from partners throughout New England. Once we've gathered those supplies in our warehouses, we rely on staff and dedicated volunteers to sort, evaluate, and prepare them for shipment, ensuring their quality and suitability for the communities where they'll be used. Finally, those same volunteers help us to pack containers, each containing up to 25,000 pounds of supplies, valued at up to $250,000, for destinations around the world. We have always responded to crises, whether natural disaster, COVID, or conflict, such as the war in Ukraine. Within days of the war beginning, we had built a pipeline from hospitals and healthcare providers in New England to Ukraine. By working with partners in transport and NGOs on the ground in Poland and Ukraine, so far, we have been able to ship over $2 million worth of aid for the humanitarian efforts there. Through the help of our team, our donors, our partners, and more than 32,000 hours of volunteer time, we delivered $4 million of supplies and equipment in 2020. Those efforts put more than 500,000 pounds of medical supplies to good use around the world and here in Maine, and kept them out of landfills. But it's not just about the numbers. It's about human impact, and while there's much more we hope to do, those efforts are making a real difference.
And that container that arrived and is in our custody, thanks to you, will be helping many people. I'm very grateful for your help, for your significant partnership.
Surplus Vatamer Medical Center is one of the biggest medical facilities in Armenia, with serve almost 12 to 15,000 inpatients. So we are very happy for this cooperation.
80% of our patients are daily wage earners. 75% of them are treated for free or at subsidized charges. We do not deny treatment to anyone for want of resources. Given our limited resource settings, this shipment coming through Partners for World Health is of immense value to us. We treasure our relationship with PWH as it strengthens our services to those in need.
Every hospital and nursing home and healthcare facility here in the United States is discarding medical supplies and equipment every day. And there are so many people in our world that need help, and we could provide them with needed medical supplies and equipment if we all work together.
Our idea works, and we've become agents of change. Our model is designed to scale, and we foresee a future where there's a Partners for World Health in every state to halt the unnecessary waste of surplus medical equipment and supplies, and redirect them to local, state, and global communities in need.
Partners for World Health cannot do this alone. We need you. We need your energy, we need your enthusiasm, we need your belief in the mission, we need your support, your financial contributions, and your connections. We need all of the partners. We need everyone to help support our mission. There is so much need in the world and so much more that we can do. And we can make a huge difference and have a major impact in our world and help people lead healthy lives on a healthy planet. Please join us.